My name is Donna Norton. I am an SEIU-UHW member. I'm an LVN by trade, and I've been with Kaiser for 32 years.
My name is Myra Castaneda. I work at St. Francis Medical Center, and I'm a sonographer there.
My name is Sonia Allen Smith. I am a radiologic technologist and an MRI technologist, and I'm an SEIU-UHW member.
Many of us have already seen cases of the novel coronavirus or the COVID-19 in our facilities.
This is definitely a serious issue.
But as healthcare workers, we know that preparation is key.
To make sure that our families and patients are well taken care of.
SEIU-UHW members are meeting with our employers
to make sure that we have a preparedness plan in every facility.
We are making sure that that plan is being communicated consistently with every member.
We also have a checklist that you can use for guidance with your coworkers and managers.
So here's how we can all make sure we're ready.
Education and training. Employees are being trained on how to recognize potential cases. Employees are also being trained on the latest information about how coronavirus is transmitted. Hand washing protocols are being emphasized on a daily basis. Employees are reminded not to come to work if sick. Employees are being trained on contact, airborne, and droplet precautions when caring for patients with infectious disease. Employees are being trained on putting on and removing protective clothing. Employees are being trained on effective waste disposal techniques related to the coronavirus. EVS workers are being trained in safe room cleaning procedures, including the appropriate time to wait before entering and the appropriate mask to wear.
Protocols. Protocols are in place to screen and assess patients for potential exposure or infection based on symptoms, travel history, and exposure history. Protocols in place to mask patients with surgical masks who may be carriers of the virus or other infectious diseases.
Protocols are in place to isolate patients who potentially have the virus. Ideally, that would be in a negative pressure room. Rooms that are ventilated separately from the regular vent system, with the doors always closed. Isolation rooms are clearly designated, and non-essential members of the public and employees are being kept away.
Protocols are in place for employees to report potential exposure, be evaluated, treated, and removed from the workplace with full pay, seniority, and benefits during the incubation period if appropriate. Protocols are in place for handling and removing food trays of patients who have coronavirus. Protocols are in place to train potentially exposed employees on how to protect their families at home and ensure they have necessary equipment at home.
Space and equipment. There are adequate negative pressure isolation rooms available, and we know where they are. We know the plans to convert other wards into isolation rooms if necessary. There are adequate amounts of N95 masks and PAPRs available to accommodate a surge in patients.
Healthcare workers working with patients are being medically cleared and fit tested for N95 respirator masks and trained in their proper use. There is an adequate supply of nitrile gloves to accommodate a surge in patients. There is an adequate supply of isolation gowns to accommodate a surge in patients. There is an adequate supply of facial shields to protect eyes, nose, and mouth. Staffing. Staffing levels are robust to handle potential patients. Corners aren't being cut when it comes to staffing. Standby staffing for critical conditions has been updated to meet this challenge. Communication. Hospital leadership is communicating often with employees in multiple forums to provide updates, reinforce prevention protocols, and combat misinformation. Hospital leadership will remain in regular contact with labor partners to ensure effective communication.
You can download a copy of this checklist on our website to use at your facility or your home.
Or contact your SEIU-UHW union rep, steward, or executive board member.